you must have heard that different clinical trials are done before any drug comes into the market. So that's a clinical trial. Okay. What in a meta-analysis, what we do that we pool different RCTs in one paper, in one analysis. Because if one RCT took 1,000 patients and he said that this drug is effective, and one RCT took 15,000 patients and says that this drug is not effective. For example, I'm just giving an example. So how, as a doctor, you would know that I should give this medicine or not? Because there are two RCTs, two clinical trials, and both of them are saying different things. In this meta-analysis come, what we do that we pool both of the RCTs in one paper and basically one pool, and we analyze the data. And whatever the results come, we are able to see, because we are analyzing all of it. After the results come, we can say that yes, this drug is effective or not. So that's the reason meta-analysis have a very big weightage, is that we are basically pooling even RCTs in our study. So it comes even more before than RCT. So I'm hoping you guys are able to understand what's a meta-analysis. I'll explain it once again in an easier term. Meta-analysis is basically we are pooling different randomized clinical trials in one pool, analyzing the data and telling the world that this drug is effective or not. That's it. If it can be a drug or anything, that's it. Okay, it's nothing different or very unique. It's something that a person cannot do. Three people in one room can do a meta-analysis, because there isn't any kind of going to the patient, and because in a clinical trial you have to go to the patient, you have to take the consent. Nothing in meta-analysis it usually involves. You can take the studies from different databases and you can analyze the data. So that's the reason people do meta-analysis, because you do not need any consent form, you do not need any patient involvement, you can do it remotely. So that's people basically try to do meta-analysis. In a systemic review is just like meta-analysis. You basically choose a topic, you extract the data, you maintain a sheet, you write a paper. But the difference in a meta-analysis and systemic review is that it doesn't involve all kind of analysis that is involved. Because in a meta-analysis, you are running different tests, you are using different software to run on the basically the data that you have used. In a systemic review, you are just checking the quality of the paper that has been published. So in a meta-analysis, you are doing quantitative analysis. You are checking the statistic, you are pooling the data, you are running different tests, and then you are giving. In a systemic review, you are just checking the quality of the papers. Right? There are different basically tests for that. Basically, there are different guidelines you have to follow, and then you have to give the numbers basically to the studies. So that's a different discussion. When we are doing the meta-analysis session, I'll be describing one by one everything. But the only purpose is telling you guys that if tomorrow you're talking to someone about research, you should know what is meta-analysis, what is systemic review. I'm hoping you are able to understand. If not, you can ask on the speaker and I'll explain it again. If you guys are able to understand, I'll move forward. Okay. In cohort studies and observational studies, these studies are really long in terms of years, because it's observing patients for a longer period of time. It's like a 5 to 10 year study. We take a patient, we give the intervention, and we check if the intervention or giving, maybe drug or something is affecting the outcome or not. So basically, cohort studies, observation studies, that's done by different principal investigators or clinical trial coordinators. Those people basically do this cohort study, observation study. You can do as well, but you have to go to the hospital and you have to connect with yourself to a physician, and you will have to go to the patient. You have to extract the data. You will be taking consent. It's a long procedure. But if you guys are in a hospital and you guys are working, you can work in cohort studies, observational studies. Specifically, the people that are, if someone isn't planning to do lab or going for UKMLE or going to the UK, they basically require cohort studies, observation studies in their basically application. So that's the reason I have many friends that have done cohort studies, observation studies. They used to do what they in our medical school, they got connected to different professors, and they used to go to different burns patients. And whatever the outcome, I don't know what the outcome was. They used to take the data, and it took around 2 to 3 years to get it published. Because in a cohort study, observational study, you have to basically first take approval from a board of that sits in your university or hospital, because it's called IRB. I don't know if you guys heard it or not. IRB basically approves that if this topic is should be done research or not. First, you make a performa, you basically proposal. You go to the IRB, you propose the proposal that I want to check this outcome and these patients. They will see and they'll say yes, you can do. Once you get an IRB approval, then you move on to the patient. So it's a really long, hectic procedure for doing a cohort observation study. But if you're doing under a doctor, that so that he will be dealing with IRB and everything, and you'll be only dealing with the data extraction and data collection, analysis, and everything. Right? So these are quantitative research that I'm mentioning here: meta-analysis, system review, cohort study, observation study. I'm hoping that you guys are with me and are able to understand. If you're not able to understand, you can tell me in the mic, and I'll be glad to repeat everything again, because I want you guys to be with me on every step. Yeah. Does anyone want to ask a question?
Yes.
No, Dr. Muzammil, going so good.
Yeah. Hello. Yeah, you can ask me.
So I had one question about systematic review. So since
Yeah.
we're not doing any analysis in systematic review, how are we deducing the final result by like analyzing all those studies? Like
Yeah.
if you
So
could.
so that's they have different skills you need to follow. When
Mhm.
we are doing the meta-analysis review session, we'll be teaching you guys. So there are different scales that we have checked every study that if they are coming at that scale or not. There is a number system to give. So we are giving basically it's a if you remember not, I know some in our school you used to give grades, right? So we are giving grades to the studies. It's like a 5-star system. So we are giving grades to 1, 2, 3. It's a different scales. They are not one scale, they are different scales, and we have to check that every study is covering these points or not. If it points this study a point, if the study covers this point, we'll give it 1 star. If it covers this point, we'll give it 2 stars. So it's something like that. It's a different scale. Everything is different in systemic review. But it's easier to do comparatively to doing a meta-analysis. So, but it's like it comes on second level. First comes on meta-analysis, then comes systemic review. So people think that if you're extracting all the studies, if you're extracting all the data, then why not do a proper analysis and do the best thing you can do rather than doing the second best? That's the reason people do. So you need to understand one thing. A systemic review cannot be a meta-analysis, but a meta-analysis can be a systemic review. I'm sorry, it's confusing, but you need to understand when we're doing a meta-analysis, you're doing different analysis, right? But you can also do these kind of tests that involves a systemic review. So I think you must have seen some papers are like any intervention in that, and then it's like meta-analysis and systemic review. It's written both. I don't know if you guys have seen or not. But if a study systemic review, that's only a systemic review that doesn't involve meta-analysis. So I think do not get involved a lot in this, because that's a different session. That's a different topic. I just wanted to give you an idea of what is a meta-analysis review so that if tomorrow you're talking to someone, you're not blank. You should know what's a meta-analysis and what's a systemic review. Okay. So I'm hoping you are able to understand what systemic review is, and I'll move forward. One thing you need
Yes.
to understand that systematic review and a narrative review is different. People confuse when I'm talking to students. They're like, "We are doing a systematic review." That's different, really different. Systematic review is something you are extracting data, you are taking clinical trials, and then you are working on it. Narrative review is not like that. I'm going to tell you what is narrative review, but first I want to talk about what is the case report. So a case report, you guys need to understand that if you are working in a hospital program or in a hospital, I would really urge you guys that you connect with the doctor and you ask them for a case report. Because a case report is basically a unique case that comes to the doctor, and it hasn't been, the doctors don't know. Like recently, I was reading a case report that a patient swallowed a whole pencil, and they had to extract it out, right? So that's sort of unique case that we basically what we're doing in a case report, we're describing the whole